which was the investigators.
Uncovering the truth, getting results, protecting you.
And they had a film crew and a smoke machine, and we were silhouetted.
Investigative reporter Steve.
One of the first stories that Jane came up with was the revelation that most of the milk in the state of Florida and throughout much of the country was adulterated with the effects of bovine growth hormone, the artificial hormone that farmers were injecting into their cows so that they would produce more milk.
With Monsanto, I didn't realize how effectively a corporation could work to get something on the marketplace. The levels of coordination they had to have. They had to get university professors into the fold. They had to get experts into the fold. They had to get reporters into the fold. They had to get the public into the fold. And of course the FDA, let's not leave them out. They had to get the federal regulators convinced that this was a fine and safe product to get it onto the marketplace. And they did that. They did that very, very well.
The scientists within Health Canada looked very carefully at bovine growth hormone and came to very different conclusions than the Food and Drug Administration in the U.S. did.
Monsanto's engineered growth hormone did not comply with safety requirements. It could be absorbed by the body and therefore did have implications for human health. Mysteriously, that conclusion was deleted from the final published version of their report.
They knew there were problems. They saw serious potential human health problems, and they stood up in Canada and said, we're not going to approve this because we don't believe it's safe.
We have been pressured and coerced to pass drugs of questionable safety, including the RBST. I personally was very concerned that there's a very serious problem of secrecy, conspiracy, and things of that nature, and something needs to be done.
The FDA was then on the hot seat. They had to come up with an answer. They didn't come up with a good one, and they never took the opportunity then. I mean, what would they do? Pull it off the market and say we need to now do the job that we didn't do the first time? They didn't do that.
We wrote the story. We had it ready a week beforehand. They had bought ads.
Farmers in the milk industry say it's safe, but studies suggest a link to cancer. Don't miss this special report from the investigators.
That Friday night before the Monday the series was to begin, the fax machine spit out a letter from this very high-priced lawyer in New York that Monsanto had hired. It contained a lot of things that were just off-the-wall false, just demonstrably false. But if you didn't know the story and you didn't know how we had gone about producing it, would have scared you as a broadcaster, as a manager.
And they decided that they would pull the story and they would just check it one more time.
But the bottom line was that there was no factual errors in that story. Both sides had been heard from. Both sides had had an opportunity to speak.
1 week later, Monsanto sent the second letter. And this was even more strongly worded. And it said there will be dire consequences for Fox News if the story airs in Florida. And this time they freaked. They were afraid of being sued, and they were also afraid of losing advertising dollars.
He called us upstairs to his office and he said, what would you say if I killed this piece? What if it never ran? And we said, well, you know, we wouldn't be very happy about that. And he said, well, I could kill it, you know. And we said, yes, of course, you're the manager. You could kill it. It would never air. And he's hemming and he's hawing and he's back and he's forth. And we couldn't figure out, what is this all about? And finally he blurted out, look, would you tell anybody? You know, I said, I'm not going to lie for you. About a week later, calls us back to the office and says, okay, we'd like you to make these changes. In fact, you will make these changes. We said, well, look, let us show you the research that we have that shows that this information you want us to broadcast isn't true. To which he replies, I don't care about that. I said, pardon me? And he said, that's what I have lawyers for. Just write it the way the lawyers want it written. I said, you know, this is news. This is important. This is stuff people need to know. And I'll never forget, he didn't pause a beat, and he said, we just paid $3 billion for these television stations. We'll tell you what the news is. The news is what we say it is. I said, I'm not doing that. And he said, well, he said, if you refuse to present this story the way we think it should be presented, you'll be fired for insubordination. I said, I will go to the Federal Communications Commission and I will report that I was fired from my job by you, the licensee of these public airwaves, because I refused to lie to people on the air. And it's thank you very much. You'll hear from us right away. Well, 24 hours came and went and we didn't hear a thing. And about a week later, he calls us back, and now we've changed strategies. How about if we pay you some money and you just go away? And I said, How much money? Because, you know, when somebody offers to bribe you like that, I always want to know if it might be worth it.
He was going to offer us the rest of our year's salary if we agreed not to talk about what Monsanto had done, to not talk about the Fox corporate response in suppressing the story, and to not talk about the story. Not talk about BGH, again, anywhere. Not take the story to another news organization. Zip up.
I said, you mean if I want to go to my daughter's PTA meetings and explain what's in the school milk at the school lunch program? I can't. No. You can never speak about this anyway. Okay, we can't buy you out. We can't shut you up. Let's get the story on the air in a way that we can all agree it will go on the air. And we started rewriting and editing with their lawyers.
Well, during this 8-month re-review process, I say jokingly, they did things like, for example, they wanted to take out the word cancer. You don't have to identify what the potential problem is, but just say human health implications. Any criticism of Monsanto or its product, they either removed it or minimized it. And it was very, very clear, I would say, almost every edit they made to the piece, that was the aim.
And we changed this and this and this, and then that wasn't good enough. Okay, now change this and this and this. Now change this and this. Version after version after version, 83 times.
83 times is unheard of. It doesn't happen. You shouldn't have to rewrite something 83 times. Obviously, they didn't want to put the thing on the air, and they were trying to drive us crazy and get us to quit or wait until the first window in our contract so that they could fire us.
They, in effect, announced that they were going to fire us for no cause. Well, this was a little much.
And Steve wrote a letter to the lawyer in Atlanta, whose name is Carolyn Forrest, the Fox corporate lawyer. And she wrote a letter back and said, "You are right. That's exactly what it was. You stood up to us on this story, and that's why we're letting you go."
Jane sued Fox under Florida's whistleblower statute, which protects those who try to prevent others from breaking the law. But her appeal court judges found that falsifying news isn't actually against the law.
Florida's appellate court has ruled in favor of Fox 13. You may recall that Jane Acree, a former reporter here, sued Fox 13 in a whistleblower lawsuit, claiming she was fired for refusing to distort her report. The appeals court today threw that case out, saying Ms. Acree had no whistleblower claim against the station based on news distortion. Fox 13 Vice President and General Manager Bob Linger says the station has been completely vindicated by the
What is in milk that you say is poisonous, and why would the government be covering this up?
Well, what's in milk? You're drinking body fluids from other animals. 60% of the cows in America have leukemia virus. 80% have something called paratuberculosis. You don't want to eat something with that name, paratuberculosis. You've got irritable bowel syndrome in America. That's what it causes. 4 million American women have irritable bowel syndrome.
Just assume it's milk. No, I don't. What's in the milk I'm drinking? What's in it?
If you ask the author of this controversial new book, you may not want to hear the answer.
The milk we're drinking is filled with fat. We know that. Cholesterol. We don't know it's filled with virus, bacteria, powerful growth hormones, proteins that cause a vast array of allergies in the human body. This is not nature's perfect food.
In a book called Milk, the Deadly Poison, Robert Cohen attacks what's long been considered the perfect food, claiming it can be a dangerous brew of chemical, biological, and bacterial agents that may also contain...
It needs to come in. I laugh when I hear people getting so upset about Roger Clemens on steroids and human growth hormone. Let me tell you something, folks. You're all on steroids and human growth hormone. Do you eat meat? Yeah. Do you have dairy? Do you have chicken? It's all steroids and human growth hormone. That's why people are so sick.
The FDA has a funny name already. They basically distribute every food item you see in the market. They named themselves the Food and Drug Administration. Why didn't they make a Food Administration and a Drug Administration, you know, individually? Okay, so the FDA is a publicly traded company, meaning they only have one objective, and that's to increase sell profits.
Recently, the Food and Drug Administration, after several suicides of young people, ordered that all antidepressants carry black box warnings that they increase the risk of suicidal thinking and behavior in children who take them. And Dwight, of course, the natural question is, why did it take the FDA so long to finally come out with this?
Are responsible for this. Things like a poison is okay if it's only in a certain amount. You know, there's so many particles per. Chlorine is a horrible poison. It's in tap water. Would you drink a bottle of chlorine? A full bottle of chlorine? No. Okay. I like just a particle of it per glass. Yeah. Right.
Only really every poison measured by the dosage and not the substance? I mean,
but any amount of poison is bad for you. More poison is worse than less poison.
Now, if I take a fistful of antibiotics, it will...
I introduced Mega Memory, and I exposed that the Department of Education was getting school systems to get the kids on the drug Ritalin, and they were giving $500 a month per kid who was on Ritalin. And I said, they're drugging the kids on purpose. The school system's drugging the kids on purpose.
Drug companies now increasingly advertise health conditions themselves. As a result, Big Pharma normalizes even the most obscure health disorders and presents them as common.
It's frustrating. Just when you're ready to relax, that's when it happens. The urge to move, along with uncomfortable sensations in your legs. They're hard to describe, but they can even keep you from getting to sleep. You feel the urgent need to get up and move, just to get some relief. There's a name for it, restless leg syndrome. And if you have it, you're among the nearly 1 in 10 U.S. adults who do. Want to know more? Visit restlesslegs.com or talk to your doctor.
I think they come up with the pill before they come up with the disease. Did anybody have restless leg syndrome before they had a pill for it? Did you get calls? Bill, I'd love to make the party, but the old restless leg is acting up again.
Things that industry does, this is probably the one thing that I think could be labeled as evil, that in order to make a profit, you're disease mongering, in other words, making population, medicalizing something that is just really part of everyday life.
You often feel distracted, disorganized, restless, unable to finish things. Like the channel keeps changing in your mind and you can't control the remote.
You guys have any thoughts?
If you felt these symptoms your whole life, you may have adult ADD.
So in other words, a person who is not yet a patient, who is actually feeling quite good, sits down to watch the evening news, and after seeing a few commercials, says to him or herself, you know, I'm not quite as healthy as I thought.
Got to remember that appointment tomorrow. Did I send the car payment? What made me volunteer for that assignment?
Introducing Lunesta, a sleep aid that can give you and your restless mind the sleep you need.
You have this huge phenomenon then, a huge increase in prescriptions.
Companies are constantly searching for new diseases to treat with old drugs. Antidepressants of the Prozac variety, or SSRIs, are a good example of this practice. Originally approved for major depressive disorder, these drugs are now prescribed for a variety of mood and anxiety disorders. Each new indication approved promises increased profits and must therefore be promoted heavily to the public. A striking example is how Paxil was revitalized as a treatment for social anxiety disorder. Its company hired a public relations firm to frame this condition as a major and common medical problem, and the firm launched a multifaceted campaign that moved beyond advertising to get stories about social anxiety disorder placed in print media and on television.
This morning we begin a special two-part series on social anxiety disorder. Many of us have suffered from shyness or fear of social situations at some point in our lives, but for millions of Americans, their anxiety can be debilitating.
Paxil's award-winning product director was quoted as saying, "Every marketer's dream is to find an unidentified or unknown market and develop it. That's what we were able to do with social anxiety disorder."